Afternoon, everybody. Here with Josh and Paul and Deirdre. I hope you had a great Lincoln's birthday on Friday and then Washington's birthday on Monday. I like to name them after two of my favorite presidents rather than just President's Weekend and Millard Fillmore and James Buchanan. They ought to be in a different category than Lincoln and Washington. But anyway, back to business, our daily summary. I think you can see here we continue to have some of our lowest positivity rates in months. And this is a trend that is incredibly positive. It's a trend we see throughout our region. We're about the same as Rhode Island, Massachusetts, a little lower than New York, but as part of a region, that's good, and part of a country, that's good. Same thing in terms of hospitalizations. Death rate +2 obviously is our lowest in a long time. Josh took some of the fun out of that by saying we probably had a hard time doing some of the counting given the holiday yesterday. But basically speaking, I think you can see a trend line that's good. The hesitancy you'll still hear, from me and Deirdre, is the UK variant is growing. I heard from the COVID task force today down in Washington that it could be 50% of all infections by the end of March. And you see what that UK variant did in terms of the potential for fast spread in places like Britain and Portugal. And as you probably read, we had the very first South African variant. And it was not somebody who had traveled. It was somebody who was local, picked it up a little bit through community spread. So amidst the good news that I'm giving you in these numbers, those are the two wild cards that we continue to follow. But the vaccine is on its way. And I got the vaccine because I'm old, and I got to tell you, it was really moving to be at First Cathedral with Bishop Bailey, who stood up and said, as your bishop and religious leader, predominantly African American congregation. I saw people lined up excited, the possibility that they're now able to get vaccinated. And he said, I understand some of your religious objections, perhaps, but I'm telling you, this is in the best interest of you, best interest of our church, best interest of our community, and I'm so glad you're doing that. And Chief Robinson of the Supreme Court, told the story of why some African Americans have some hesitancy when it comes to vaccines and some of the lousy things that were done in the past. And he said, that's true, but now this has been certified. I'm looking at it. It's the best thing you can do for yourself and your community. Reg Eady, of course, was there. He and Deirdre have been leading our vaccination task force. There as head of Trinity Hospital. Sean Wooden. Sean's our treasurer. And he, I thought, told a moving story about being on Thanksgiving and Zoom and all of his family there. Just ask him, how many of you have been tested? Because testing was readily available and no hands raised. And it just reminds us how we have to continue to give people a sense of urgency, and this is the right thing to do and the safe thing to do, and it's incredibly effective, but it's only effective if you take the vaccine. So I took the vaccine. Doesn't hurt a bit, and one small jab for man and break the back of COVID for mankind. That's my motto I stole from Neil Armstrong. Here's the vaccine update, which I think is worth seeing. We're still, one of the top ranked nationally in the country. By that I mean you give us the vaccines, we get a shot in the arm. 2/3 of our folks 75 and over have now been vaccinated. That makes an enormous difference. That's the population most vulnerable. You see how effective it is by reflection, lower positivity rates, lower hospitalizations, and I believe lower fatalities. That's in no small part thanks to the vaccinations there. Almost 25% of 65 to 74-year-old. We went from 75 and above to 65 and above. That's where 90% of the fatalities are, and we're catching up. We are catching up. That's a population where we're beginning to get more vaccines now from the federal government. Daily record on Friday, 28,000 vaccines administered, a 22% increase in the supply. And we met with the COVID task force, like I said, by phone. That's Jeff Zients. That's Dr. Linsky. She runs the CDC. That's Marcella Nunez-Smith. Remember, she advised us on reopening, now advises the Biden administration on serving underserved populations. The good news is they're going to double the number of vaccines going to our pharmacies starting next week, and we'll be up to a total nationwide of 13,500,000, which we get about 1%. So that's an enormous increase from just a month ago. And that's why when I tell you we're going from 75 and above to 65 and above, the essential workers, hopefully the pace will pick up if the vaccinations continue to pick up. We're doing everything we can to build our infrastructure. Josh can tell you about the mass vaccination center we've got set up at the University of Bridgeport, taking the vaccine to the community, and that's what we're doing at First Cathedral today. One note of caution, and they warned us that the storms are being very disruptive. Here in New England, we're pretty good at storms, but you're finding, looking at pictures of Texas and other places, they're not quite sure how to handle it. So out of Kalamazoo, where Pfizer comes from, they're de-icing planes, trying to get people there to sort the vaccines. That may slow us up for a couple of days. And that's true of Memphis and Louisville, where the Moderna comes via Federal Express. But basically, they gave us a little shout-out. I mean, they said, I don't know about a shout-out, they threw us a brushback pitch since it's soon to be baseball season. And the governors were saying, give us more vaccine. We can handle more vaccine. Demand is outstripping supply. And he said, look, we're going to continue to distribute vaccine. It's going to ramp up. Supply could outstrip demand. And we're going to distribute vaccine based upon, A, your population, and B, your performance. So that's why, Josh and I are, so proud that Connecticut is, near the top in terms of performance. And the Trump administration recognized that, and maybe we see what we get in terms of additional vaccines down the road. So one of the things, because of the numbers trending in the right direction, it's important for us to give you guidance in terms of what we can expect going forward. And we loosened the curfew and made some small changes in terms of restaurants just going back a few weeks. We wanted to announce today that, a month from now, assuming the numbers are good, working with our event planners, those that create events at commercial venues, we're going to greatly increase the capacity there. I think it's about 25 right now for indoor. We're going to increase the capacity up to 100 people, or 50% capacity, starting March 19th. And outdoors, which, as you know, continues to be much safer, that's 200. Maybe not so great on March 19th, but by April you can start planning accordingly. So we want you to think about that. Event planners tell us you need time to plan, so that's why we're giving you a month to plan this. And I know you want some guarantees. We can have a big wedding in July. I can't give you any guarantees, but right now the trends are good, and that's why we're giving you this reopening for events starting on March 19th. And I think by Thursday we're going to be talking about attendance at sports events. So you maybe have a chance to see your kid play hockey or basketball while you still have a winter season in high school sports. Finally, I just wanted to tell you a little bit more about the schools, because that's all part of the trend lines that are headed in a better direction and what that means. I mean, I've been so proud of our schools. I've been so proud of our teachers. I've been so proud of the paras, so proud of the nurses and superintendents, keeping our schools open, but keeping our schools safe. Keeping our schools safe. That's important for your health, and that gives parents confidence that their kids can go to school safely. And every week, a few more of our kids are able to go to school safely. This chart that they put together, I think you can see that the number of cases of students and staff, these are folks who test positive for COVID, have gone down dramatically. That's 605. That's 605 students out of 500,000. That's like 0.1%. It's about the same for staff as well, doing everything we can to keep you safe. And I just wanted to give a real shout out to the folks who are taking that seriously. We're going to be rolling out our extra money for schools very soon, be able to announce what that $200 million a year is. Look for your creative ideas and how we can make up for lost time and make sure this next school year is the best ever. With that, let me open up the questions with Deirdre, Josh, and Paul, and myself.
Channel 3 Eyewitness News.
Yes, Governor.
Governor, kind of just staying on the topic of schools, you've been a big proponent from the beginning of keeping them open. The CDC has new guidelines that agree with you. Do you foresee a point in this school year where the state is going to make the decision to reopen all of the schools?
We never have, and I'll tell you, but we don't have to. I mean, I'd say, well over 90% of our schools are open for in-person learning, and a majority of them are full-time in-person learning. So far, so good. There's no schools that are saying no because I don't want my kids going to school. I think teachers are showing up and are really doing the right thing. So I don't think we're going to have to be more directive than that.
My final one, Governor, when it comes to the variants, it seems like that other countries are testing around 5% of their cases looking for these strains. At what rate are we testing here in Connecticut?
I know nationwide we've increased our genetic testing on these variants by a factor of 50-fold, I believe. But Deirdre, do you have better information than that?
Yeah, we are also, Governor, ramping up our capacity to do genomic sequencing. We're going to be putting that capacity in place in the state laboratory, which we haven't had up until now. And we're also coordinating with 3 private labs in the state to direct specimens to them that have a footprint that might indicate it's one of these variants. We're also sending a couple dozen specimens every other week down to CDC as part of their national collection program. So it's still a relatively small, probably less than 100 cases that we're sequencing in total every week, but we're working hard to ramp up that capacity.
NBC Connecticut.
Good afternoon, Governor Matt Austin with NBC Connecticut. I know it's been a few hours now since you received the vaccine. Have you had any side effects?
No, I haven't. I feel pretty good. They've said, maybe the second vaccine, you'll feel a little more pain in the arm, but so far so good, Matt, and thank you for asking.
Good to hear. In terms of the increased doses that you were talking about earlier from the federal government, would that allow currently eligible people to get their vaccine faster, or would that also allow an expansion of who's eligible?
Well, right now we're running through the 65 and above group. I'd like to think in 10 days or so we'll be able to make an announcement in terms of the next group, which will probably be essential workers. So we continue to expand the group of people who are eligible.
Gotcha. And has the state also been tracking the wait times for calls to the assist line? We had a lot of reports last week that there were long waits to get a call back.
Well, I'll start. That's why we don't open the aperture to everybody, so it's a bum's rush and people are making reservations 3 months in advance if they can get through it all. But, Josh, you know how we're doing on wait times?
Yeah, as the governor mentioned, every time we open up a new phase to a large group of people, there's going to be a rush for people to get a very limited number of appointments. And so all of our providers, both the team at United Way 211 who's answering the phones, as well as all of our other providers around the state, are in the difficult position right now where they have more calls and appointment requests coming in than we have doses to supply them and appointments to supply them. But we're getting through that. In the announcement today from the White House that we're going to be getting another 22% increase in the doses we have next week will help us get more of those people in sooner. So it's people who are waiting for that call back, they should be coming faster in the coming days.
And I'll just add that the assist line is open now 8 to 8, 7 days a week. I called last week and left a message and got a call back within a couple of days, and I know some others as well. So I know that people are anxious to get their appointment, but be patient and you will get a call back from our terrific staff at 211 and our contact tracers that are working with them to help you get an appointment scheduled.
Appreciate it. Thank you.
News 8.
Governor, you've talked about event planning, but how about travel? Do you think about loosening restrictions on travel at all, since the numbers around the area seem to be pretty good?
Yeah, I was talking to Paul about that. He, leads our relationship with the other chiefs of staff, and it does seem, an important time to take a look at this, especially with more testing going on. We can test and even vaccinations. So I think we'll have news for you on that in the next week or so, subject to discussions with our other states.
And how about bars? I know that that's kind of the last thing, maybe, or what does it rank for you?
I still think it's the most complicated, but certainly the most complicated indoors for reasons I think people understand and why, many states it was the last thing they opened if they opened at all. But I'd like to think within a month or so we're going to be more likely to be outside, and that will give us a real chance to take a look at bars as well.
Fox 61.
Hi, Governor. As we know, CDC does not list vaccines as key to reopening schools, but you've been pretty vocal about making that a priority for educators here in Connecticut. But how do you plan on doing that? For example, would a state mandate ever be placed on teachers and staff, or do you just plan on making sure they have the option to get vaccinated as soon as possible?
The latter, that they have the option. I'm going to make it as easy as I can for people. Right now, we have teachers get priority testing so they can get tested on a regular basis, make it easier for them, but no need to mandate this. I think a lot of people want to get vaccinated.
Then staying with schools, as you mentioned, about 90% of the schools in Connecticut are doing in-person learning or hybrid. But we know in the beginning of February, there were a couple of big districts like Waterbury and New London that were sticking to fully remote. Weather did have a little bit of an impact on that. But what's your message to those districts that are still doing fully remote learning, and to the parents, maybe the teachers at those districts, considering the low COVID percentage rates we've now been seeing for a while?
Yeah, I have to check on those. I didn't know about those districts. I know New Haven, which was closed for most of the fall, or even open up for 5th through 8th grade, which I'm really happy about. Those kids have been out of the classroom for an awful long time. Look, I think the message is clear. We've shown that we can get schools open. We've shown we can do it safely. We've shown our teachers are amazing, and the paras and the nurses able to keep your kids safe, keep that environment safe. And you see that reflected in the numbers, which are much less than they are in the general population. So I'd tell, if New London and Waterbury still need a little time, I think now's the time.
News 12 Connecticut.
Hi, Governor. Glad to hear you're doing well after your shot. I just want to clarify what you said a few minutes ago when you said maybe in the next 10 days we can talk about reopening them up. Are you thinking that would be an announcement in 10 days, or do you think within 10 days that group could open up?
I think it'd be an announcement, John. We got to see what the take-up is for the 65 and above. We got to see if the supply keeps up. I told you it may be slowed up due to snow. So there are a couple of variables there, but I think we'll be able to lend some real clarity by the end of next week.
The CEA, Connecticut Education Association's holding a press conference tomorrow demanding that teachers get vaccinated right away. What's your message to them?
They're right in our essential worker category. We're going to be making an announcement about essential workers in 10 days or so.
And I just want to follow up on what you said about the South African strain. You said it appears that it came from community spread. Can you guys elaborate more on that? How do you know that? Have you done contact tracing? Is there a belief that there are others out there with this strain?
I'm going to pass this right to Deirdre. All I know is I read in the paper that this person hadn't traveled or come from a foreign country or met with somebody, so that can't be the tie. But Deirdre, do you have any better info?
Yes, so you're correct that we don't have any travel history for this individual. So the assumption is that they encountered this variant here in Connecticut. And we have done contact tracing. That work is ongoing. And we do anticipate that there will likely be other cases that are identified as a result.
The Associated Press.
Thanks, Max. Good afternoon. Governor, yesterday in New York, people with pre-existing conditions were allowed to start getting vaccinated. We're hearing from people here in Connecticut in the same boat, wondering why that's not allowed here yet. And wouldn't that be a way, just to play devil's advocate, to reach underserved communities, even to reach essential workers? Because you would assume a lot of those folks would have pre-existing conditions, and then they would have a doctor reaching out to them.
Yeah, let me start and then pass that over to Josh or Deirdre. Look, people 65 and above are twice as likely to have pre-existing conditions or comorbidities already, so we are capturing a lot of that with the demographic and age-related. But those who have those conditions are going to be prioritized alongside the essential workers. I was talking to Reg Eady, and the hospitals are going to be thinking about calling out to their patients who have a particular need, get them in, get them prioritized in terms of getting vaccinated. And you're right. When we go out to the churches, we go out to the those underserved communities, make it a big priority. Even if they don't have a doctor, to make sure that they are vaccinated. Those folks who are much more likely to have diabetes or another pre-existing condition that could make COVID a lot more dangerous.
So does that mean, just to clarify, that you're saying like in about 10 days, we're going to have an announcement on essential workers? At that same time, around that same time, people with pre-existing conditions might be able to start getting vaccinated as well?
Yeah, that's my understanding. Josh, you want to add to that?
Yeah, as the governor announced when we opened up to 65 and above, last week, he expected it would take 3 to 4 weeks to get through that group. At which point in time, we're looking forward to being able to continue to expand access to the next group of folks as the governor recommended. I know a number of other states have done this differently. Some other states have thrown a lot more people into the eligibility pile at once, but there's a big difference between being eligible and actually having appointments to be able to get vaccine. And so what we've tried to do is really prioritize and phase it in. But that group with folks with pre-existing conditions, we agree, critically important to prioritize, and we're really looking forward to opening up access to them very soon.
Okay, great. Thank you for that. And also, the Biden administration has a plan to open, I think, 100 federally run vaccination centers. Are we taking the feds up on this offer?
Yes, we are. We have applications into FEMA, which are being reviewed, and sites are being evaluated right now. And so we're excited about hopefully having some announcements to make there in the not too distant future. We are looking at both a mass vaccination site in the Bridgeport area that could serve the kind of both that city as well as the southern part of the state, as we have several mass vaccination sites in other parts of the state as well. And then we also have requests in, they have offers to do smaller mobile teams, which we believe is a critical element of our ability to do outreach, particularly in our cities and underserved communities, and go in like the governor was today, at churches even, and hold smaller scale vaccination sites. And FEMA has made that option available as well, and we're looking to take them up on as many of those mobile units as we can get to complement the dozens of other mobile units we already have stood up around the state through our other providers, our local health departments, our federally qualified health centers, our hospital systems, who are all really mobilizing right now to provide access to every corner of our state.
I know also this maybe is what you're referring to as well, but the feds have a plan that they administer vaccinations directly through federally qualified health centers, and they would be doing it. And I know some governors are concerned that it might conflict with efforts that are already underway. Is that what you're talking about as well?
Well, we're thrilled. Any additional vaccine that's being delivered into the state of Connecticut, we're thrilled with. So we welcome it with open arms. We have been supplying our federally qualified health centers with vaccine out of our state allocation from day one. It does add a little bit of additional complexity just coordinating who's getting what from where. But we're happy to have more vaccine coming in, and we look forward to more guidance from the federal government about what to expect there.
Okay, thanks a lot, everyone.
The Waterbury Republican American.
Thanks. Do we have a number on how many first and second doses we're receiving on a weekly basis now?
We do. So last week we got just over 59,000 first doses, and next week, that's for delivery this week, and then next week, as mentioned, that 22% increase will bring us up to about 72,000 first doses. And then the second doses follow the 3 or 4 week interval in terms of how many first doses we got, 3 or 4 weeks ago, depending on whether you're talking about the Pfizer or the Moderna vaccine. So that fluctuates just on what we got in the past.
Okay, and I believe you said last Thursday that 75% of the vaccines were going to, I believe, the 34 communities with SBI indexes of 75% or higher, and then an additional 10% was being directed to them. Do we have any statistics on the number of residents of those 34 communities that received those vaccines? I mean, I imagine if you're sending vaccines to sites in Bridgeport or Waterbury or Hartford, you're getting people from surrounding towns and some from far afield.
Yeah, that's absolutely right, Paul. We are trying to make it as easy as possible, particularly in our cities, to have vaccine access very close to them and their communities. But many of those sites do serve people from all neighboring towns. So we have put a map up on the state's open data portal, and we've published that a couple times, that shows vaccination rates within the municipalities just for the people who actually live there. And that's helping us identify areas where we need to provide more help and more interventions for those local teams to make sure they're staying at pace with our progress across the state.
And maybe Dr. Gifford could help us out. I had a reader question and weren't able to get it answered last week. Readers wondering why aren't vaccines available through their doctor's office like a flu shot?
The first two vaccines we have pretty tricky storage and handling requirements, particularly the Pfizer vaccine with the ultra-cold storage needs. They're not quite as nimble and easy to store and handle as routine vaccinations. So that was one reason. And then the other reason is just because of the scarcity of supply right now in these early stages. It's been, most states have opted to have a smaller number of larger throughput sites rather than a very large number of smaller throughput sites. But we do anticipate, and I know I've heard feedback from physicians as well, we do anticipate that as our supply loosens up and maybe as we start to get vaccine products that have less tricky storage and handling requirements, that physician offices and other community healthcare providers will become much more significant parts of the administration program like they are now for regular adult immunization.
Okay, thanks. And in terms of this announcement in 10 days, will the governor's COVID-19 vaccine advisory group be making a recommendation to the governor before then regarding the sequencing? Obviously, there are, I think there's like 8 general categories of essential workers included in this next phase, plus individuals 16 to 64 with pre-existing health conditions. Also, are there going to be recommendations regarding the list of health conditions that would qualify someone for a vaccination, a spot in the vaccination line?
Want me to take that, Governor?
Yeah, go ahead.
Yeah, so we've been working very closely with our advisory group, and we'll be generally, again, as they have recommended, relying on the work that was done by the Advisory Committee on Immunization Practices and the CDC as the foundation of that of the next phase of recommendations. So we'll continue to check in with them, but anticipate that we'll rely substantially on the work that CDC has provided us with already.
Well, I asked because, and this will be my last question, I asked because we have the teachers saying that they should be given priority, and I'm sure there's other categories of essential workers who would be included in this upcoming group that said, no, we should go first. So it's obviously a difficult task to do, but I'm just wondering, are there going to be any kind of specific recommendations being made prior to the announcement in 10 days or so?
I don't think so, Paul. Josh has convinced me that CDC has narrowed the group of essential workers to a number that we can maybe get all of them vaccinated in 3 weeks, give or take. And I think it's really important that that list of essential workers, as determined by the Center for Disease Control, all have access to the vaccines, probably starting as soon as 2 weeks or so, 2.5 weeks.
Okay, thank you very much.
WTIC 1080 News.
Hi, for Dr. Gifford, what else do we know about the case of the South African variant? Is it resistant to vaccine? Is it much more dangerous? Can you fill us in a little bit scientifically?
Yes. So the latest CDC information on this particular variant is that it's not more deadly or more doesn't cause more serious illness than the more typical variants that we see. So that's the good news. There's some suggestion on this particular variant that it may be able to avoid some of the effects of some vaccine products, but we believe that the vaccines that we have right now in the U.S. are effective against this variant. So that's the really good news. But scientists around the world are monitoring all of these variants and checking their resistance to any kind of vaccine. And I know that the vaccine manufacturers are also monitoring them so that if we do start to see an important challenge with vaccine efficacy, they will be able to adapt. But right now, the important thing about this variant is that we need to just remain vigilant about transmission. Make sure that you're wearing your mask and all the times when it's important to do so, that your mask is worn properly over your nose and mouth, and that we're still following the social distancing guidance, et cetera, so that we can get everybody vaccinated before these variants have a chance to take off in our state.
Governor, a lot of restaurants have been on pause. We're hoping to get expanded capacity soon so they can survive. What's coming up on restaurants?
Well, right now we're at a 50%, which is more than most of our peers, starting with New York, and at 11 o'clock. So I think we'll be taking another look at that, but not immediately. I'd like to think that outdoor dining is going to get easier and easier for them as the weather warms up just a little bit. And I'd love to see the legislature come up with a bill that allows the outdoor dining to continue after April 20th.
The Day of New London.
Thanks. Julie Bergman with The Day. I have a question about the second doses. It sounds like they're obviously based on how many people are allotted the first doses, but have there been any issues with supply there as far as people not getting inoculated in those 3 and 4 week timelines as recommended?
Not so much as there, Josh.
Go ahead, DJ.
No, not significantly. We did have a couple of bumps earlier on in the process where some of our clinics were not scheduling the second doses right at the same time they were scheduling the first doses, and so a few people got delayed. We've been working closely with our providers, and I want to give them a lot of credit, not only for working on this issue of second doses, but just for the terrific job that they've been doing in getting vaccination distributed here in Connecticut. So we've got scheduling solutions that we've been working on with our providers. The doses have not been an issue. The federal government ships those to us when it's time. So they look at how many first doses we've received, and then they ship us the second doses right on schedule. And there's been no interruption in that process at all.
Thank you. And then one last question for the governor. Throughout the pandemic, you've talked a lot about hospitalizations and how that's factored into the restrictions you've put in place. How will these different variants factor into your sort of decision-making on restrictions going forward?
Yeah, Julia, that's a great question. You're right. Hospitalization was the key metric. I wanted to make sure we had the capacity to take care of people if there was a surge or a spike. And right now our hospitalizations are as low as they've been in 3 or 4 months, and that was before the last little rise. We watch these variants. We see how they hit Europe really hard. But again, that's why I'm probably a little more cautious than the numbers would otherwise imply. But we're going to have a lot more clarity in the next week or two.
The Connecticut Mirror.
Hi. The 22% increase in vaccine supply, does that represent a sustainable increase in supply, or is that just an anomaly?
I think it's sustainable, Paz. listening to Zients talk, this is the beginning of a trend where you'll see the number of vaccines we're receiving accelerate. You've probably heard that they've just doubled the contract with both Moderna and Pfizer, and J&J is going to, have their approvals probably by the end of this month. There's a difference between approvals and contracts and actually getting those vaccines, so there'll be a lag time there. But I think it's a trend line that's going to continue in the very positive direction.
And where do you stand on articulating who's going to be an essential worker and what will the comorbidities be? So far, you have erred on the side of flexibility, I think has been your approach, but it looks like this next phase may require a fair level of detail. So where does that stand?
Well, I'll start. Fortunately, the Center for Disease Control has come out with a very clear list of those who are deemed as essential workers, which does include teachers. And they also have a pretty clear list of comorbidities. So I think we'll start with that as a template. But Deirdre or Josh, do you have something to add to that?
No, that's right. And as the governor said several times, we will have more information to share next week.
Okay, we look forward to that. On an unrelated matter, Connecticut is involved in a multi-state fight over how commuters are to be taxed. And this is one of the examples in which Connecticut seems to be at odds with New York. Your tax commissioner referred to New York as an income tax bully today. So, Governor, are you going to be able to resolve this amicably, or is this going to require a federal court to rule?
Well, it's certainly going to go to the courts, and it's probably going to go to the Supreme Court. As you know, Paz, we joined New Hampshire, which was having a similar battle with Massachusetts. What they do is Massachusetts tax New Hampshire people, even though they're working out of New Hampshire, because they happen to work for a Massachusetts company. New York taxes people in Connecticut only because they happen to have an office in New York, even though they're working out of Connecticut. It used to be you were taxed based upon where you work. If you're in New York half the time and Connecticut half the time, you paid half and half. So that's what the dispute's going to be about, and that's going to be adjudicated, I think, in the courts.
And I'll just add as well, like I said, we're one of the very few states that have the situation in which, as the governor mentioned about Massachusetts, we have individuals in Connecticut who are affected by the Massachusetts rule, similar to individuals in Connecticut affected by the New York rule. We joined New Jersey and other states as part of the amicus brief that's currently in the Supreme Court. And also, while we want to provide some clarity to our taxpayers now, while we have our friends on the other borders, we feel it's important to protect Connecticut-based taxpayers and make sure they're treated fairly.
So, Governor, any opinion on whether New York is an income tax bully?
A little aggressive, I find.
Okay, we'll leave it at that. Thank you, sir.
Thanks, Max. I have a question on grants, small business grants. Do we know how many have been awarded? We've heard some complaints from folks who put in for it, and they contacted the ECD, and then they never heard anything back. Is there a backlog of some kind?
Hugh, maybe let me get David Lamont here next week and give you a complete breakdown of all the grants, how they've been awarded, who they were awarded to, and I think that I'll get you a complete answer.
Okay. Here's another sort of specific department question for you. Does the state have any plans to require towns to continue to support remote learning for immunocompromised students come the fall? I guess the CDC has recommended this, that we at least give folks the option to opt out of in-person learning if they or somebody they live with is immunocompromised.
I think it makes all the sense in the world, Hugh, whether we have to do that by mandate or the districts decide to do it themselves. But COVID's going to be with us for a while, and it's not like everybody's necessarily going to get vaccinated, and there may be some kids who are immunocompromised, so we got to make sure they stay safe. And more broadly, I think you're going to find virtual learning is going to be a big part, a complement to in-person learning forever in this state, in this country.
Okay, and one last thing on with these sort of variants maybe picking up steam. It seems like the UK one has doubled since the last time we talked about it. Do you have concerns that this maybe isn't the best time to lift the indoor capacity, venue capacity, or what's your thinking on that?
My thinking is that it was first detected a little less than a month ago in places like Miami and San Diego. We've got a month of experience there. We know that we have a month more of people vaccinated, so I think we're putting up, I'm not sure I could say firewall, but certainly some things to keep us ahead of what the UK variant could be. I think the vaccines work pretty well against the UK variant, so I think we're moving cautiously, but moving towards reopening.
Okay, thank you.
Connecticut Public Media.
For those planning an event in maybe May, June, July, we've just seen over the past few months during the pandemic conditions change, venues being able to have 100 over the summer, then not again. Is there a certain metric that you can finally give where these venues might know, like, oh, we're getting close to a 5% infection rate, we're going to have to roll back?
We've never had an absolute metric, but we do look at hospitalizations as something key that tells us a good idea of capacity. And it's less that it's 1% or 3% or 6%, but I do look at the trend lines, as I said before. If I saw something that looked like it was spiking, all of a sudden the South African variant looks like it's caught on fire, we have some flare-ups, you'd have to take a second look. That, unfortunately, is what happens in this COVID world. Things can change.
And then what about like concert venues like the XL Center, the Webster Theater? What does that apply to them as well, or is this strictly type of catering venues?
I think we are applying there, aren't we, Josh?
Yeah, if they're having private events, parties, et cetera, this certainly applies to them. And then, for their general entertainment purposes, we have, 50% capacity restriction and distancing and masking required, but they're allowed to be open now.
Hearst, Connecticut Media.
Hey, good afternoon, Governor. Earlier today, a lot of parents said they didn't want their kids to be vaccinated during the public hearing. What do you think of their complaints on the day that you got your first shot?
I was at a church where people were lined up, so looking forward to the opportunity of getting vaccinated, what that meant for their family and their community and their own peace of mind. Look, maybe there's some parents who are mixed up in the anti-vax thing. Right now, I'm doing everything I can to encourage people to get vaccinated. Don't worry about your kids at this point. Don't create problems we don't have. Frankly, none of the vaccines have been tested for kids under the age of 16 at this point. So we don't have to cross that bridge for some months.
And then on that announcement coming in 10 days, do you expect that there will be tiering to the essential workers, or more specifically to the people with medical conditions, so sort of like we did with 65 and older and 75 and older?
When you say by tiering, I think it's going to be all those essential workers determined by the CDC and all those folks who have the pre-existing condition as determined by the CDC. And we'll open up that lens. Maybe there'll be a bit of a crowd for that first week or so. There always is. But I think you'll find we were able to push through that group in less than a month.
And then besides hospitalizations, are there other metrics? You just said that you're kind of watching the total trend lines. Are there some other metrics or some other triggering events that you could say might cause you to halt restrictions? Halt reopening?
Yeah, Deirdre and Josh can help me out with this as well. The other thing I look at is what's going on in my neighboring states and what's going on in the broader region, because maybe you can get a little heads up in terms of what you got to watch out for then. Right now, the trends in the region and the trends in the country are all trending in the positive direction.
Thanks.
The Hartford Courant.
Hey everybody, this is Emily Brindley from The Current. First question on reopening. So, Governor, you put that event venue expansion on March 19th. Should we expect any other reopenings in the interim in the month until then, or are you kind of marking that as the next step of reopening?
Emily, I think we're going to, Paul is talking to the sports leagues to see what we can do in terms of allowing folks to see their kids play sports.
Are there any other things under consideration for the next month or so?
I think, going forward, as we move more towards an outside venue, I think you'll maybe see some opening of restaurants and maybe even, being able to get a drink. But I think outside is so much safer than inside for that activity.
Okay, and then I also wanted to ask a bit about the disparities in vaccination, which obviously you and your administration have talked about a lot. And one of the things that you bring up, rightfully so, often is that Connecticut is among, the top in the country for total numbers of vaccine distribution. And then, of course, we know that the data shows that there are some big disparities, especially among people of color. So do you feel that there's like a bit of a trade-off between efficiency and equity? Like, do you think that you're balancing the two of those as you go through the vaccine rollout?
I don't, but I'll start with that. You're right. We got mass vaccination centers, making sure that as many people as quickly can be vaccinated as you can. Often they have a car. Often they're pretty good with an iPad, so that can be sort of a self-selecting group. But there's no trade-off. We are over-allocating to those underserved communities. We're bringing mobile vans to those underserved communities. We're there with ministers and other trusted advocates in underserved communities, doing everything we can to make sure that they're at the front of the line when it comes to making sure they can be vaccinated, because they suffer the greatest risk.
Yeah, and I would.
Oh, sorry. Go ahead, Josh.
I would add to that. The issue with the disparities is a national issue. We talk to our peers in other states. Everyone is really working hard at this, and states that are not going as fast as we are have similar challenges with regards to the disparities. So this is, as the governor said, a major focus for us. We are focused right now on making sure that every mobile clinic, every provider who's doing specific outreach in underserved communities is not constrained by the amount of vaccine that they're able to get through the state allocation. We're loading them up with everything they can handle every single week. So we're going to keep pushing hard. And if that sacrifices a little bit on speed, we've already decided that we are going to make those trade-offs and have made those trade-offs and still are able to execute very well thanks to all the hard work of the great team at DPH, all of our partners and providers, our municipal partners. It's been a tremendous team effort across the state so far.
And one last thing on the disparities there. Governor, I've heard you talk a number of times, including today, about vaccine hesitancy. In your view, is that the main root of the disparities?
I think that's a big part of it. I mean, we've tried to prioritize underserved populations from the very beginning, and I got, there was some pushback, and there was some questions about maybe I'd like to wait. As you know, in the nursing homes, Emily, we went there, the residents were the first to get vaccinated, 99% did. A lot of the nurses were hesitant, often women of color. But look, I'm not letting our team off the hook. We can continue to always try and do better. A, in terms of advocacy, and B, making it easier for people to get vaccinated and let them know that they can do it safely. That's what the event today was all about.
Yeah, and I'll add, the governor has stated, he put this charge to all of us to make sure that we make sure that equity is fully involved in our vaccine distribution plan. And I will also add, from the event today, you heard from Supreme Court Chief Justice Robinson speak of vaccine hesitancy. So you heard Connecticut Treasurer Sean Wooden speak of vaccine hesitancy when it comes to our communities of color. You heard Representative Bobby Gibson from Bloomfield, speak of the same issues. So it's not just the governor saying it, it's the very people who represent the communities that are dealing with this hesitancy. And we're going to work hard at it. The state is partnering with clergy. We're partnering with organizations like Health Equity Solutions to make sure we get the information out there to everyone when it comes to the vaccine. If there's a question, we have the answer, and we want people to be comfortable. We want them to feel that this is important for them, their family, and their community. But first and foremost, they need to make sure they have the information, and we're going to provide them the information. We're going to work very hard at it. And that's what today's event was about. The governor could have got a vaccination anywhere in the state of Connecticut. he decided to get it at First Cathedral Church, a very prominent African American church in the state of Connecticut.
And so, Governor, just to clarify, in your view, the disparities are more due to hesitancy and not as much due to access?
We're doing everything we can, I think, Emily, to make access easier. But as Paul just said, I think so eloquently, there is real hesitancy in some communities. And hesitancy goes back generationally because of some of the abuses that have taken place. We're trying to disabuse people and say this is a safe and effective vaccine. Take the lead.
All right. Thank you, everyone.
I guess I'm getting the signal right now. So, hey, look, thank you, everybody. I think the trend lines, the bad lines are trending down. That's infections, trending down in terms of infections at our schools. The good lines are trending up. That's vaccinations, more and more people getting vaccinated. But nothing works better than the mask. Keep at it a little bit longer. Thanks, everybody.